Introduce myself. I am the program director of the Physical Therapist Assistant Program, but I am also a full-time faculty member at Malcolm X. So I do a significant amount of teaching as well, in addition to managing the program. So I love telling future students about our profession and helping you along the way and getting involved in that. I am a physical therapist by background. I worked clinically for many years, primarily in the area of treating patients who had suffered neurological injuries like spinal cord injuries, stroke, Parkinson's, things like that. But I've made my way to teaching, and that is definitely my true passion. So let me, Afra, can I share my screen? So I do have a quick PowerPoint that I did put a copy of in the chat. I also put a link to an FAQ document that covers a lot of what we'll talk about.
You should be able to share now.
I can. Can you all see my screen all right?
Yep.
Okay. So I wanted to make sure everybody was seeing what I was saying. Okay. Good. Welcome to the session. We're going to talk a little bit about the Physical Therapist Assistant Program that we offer here at Malcolm X. All right, so first off, I know a lot of us kind of are at different places in your interest about PTA and the field of rehabilitation. So I wanted to start with a really quick overview for people who might be more on the undecided aspect of the spectrum, and then we'll get into a little more specifics about, nitty-gritty coursework and how to apply for the program. So just to start off, a PTA is part of the rehabilitation team. So when we talk about the rehabilitation team, PTA works very closely with the supervising physical therapist, also probably aides, as well as other members of the allied health medical team, so occupational therapists and speech therapists, doctors, nurses, et cetera, because that teamwork really is what produces the best outcomes for the patients. So and then what is rehabilitation? Our primary field, I really like this definition that says the treatment or treatments designed to facilitate the process of recovery from injury, illness, or disease to as normal a condition as possible. And I think that really nicely sums up, what our goal and what we're striving for with our patients, and why a lot of us get in the field, that we want to help people recover from injury and lead the most normal and fulfilling life as we can. So what does a PTA do? I certainly could not fit everything on one slide, but a lot of the great things that we do include helping a patient regain strength, maybe decrease their pain, return to work or school or play, whatever is relevant to the patient at their age, relearn to walk, and just increase their independence in general with not relying on other people for assist, or not relying on a walker or a cane to walk safely. And then also just to understand the importance of leading a healthy life and incorporating movement and exercise. And again, there's so much more, and I am happy to dive into any of those bullet points if that would help. So where do we work? Also, tons of different work opportunities in PTA field. And I think actually a lot of people don't know nearly everything that PTs do and where we can work. So just some of those places include hospitals, skilled nursing facilities, which are nursing homes. We work a lot in home health, which is a really booming area of healthcare. Outpatient clinics, which is usually what people are most familiar with, and that can be your Athletico or ATI type of locations, that it can also be like a smaller practice, or it could be as part of a hospital or hospital system. Medical offices, similarly. We work in schools, so pediatrics is an area of specialty in physical therapy, and then sports and fitness facilities as our options as well. So tons of diversity in terms of what you can do as a PT or a PTA. So to just further elaborate on that a little bit, some of the types of injuries that we see, everything from sprains and strains to post-surgical ACLs, rotator cuff, joint replacements, to patients with heart conditions or osteoporosis or Alzheimer's, children with Down syndrome, for example. So this is also not an inclusive list, but I think just really emphasizes that there's so much to PT and what PTAs can do and who we can help. So we do work as part of a team, the rehab team. Most closely are the PTs, the PTAs, and the PT aides. And these three positions do differ. I'm happy to talk more about the difference between PT and PTA if anybody here is would like to dive into that a little bit more. Some of the key differences come in with level of education. So PT aide is on the job training. A physical therapist assistant is an associate's degree, which is what we offer at Malcolm X. And a physical therapist is a graduate degree, so requiring a bachelor's degree to enter into one of those programs. In terms of supervision, their requirements, aides work directly under the supervision of a PTA or physical therapist. And then physical therapists and physical therapist assistants are your levels of therapists that are going to have a license, and that gives you the freedom to be a very autonomous practitioner and work freely, really, within the profession. Again, I'm happy to provide more detail, but I don't want to overwhelm with detail as well. So what does a career as a physical therapist look, or the physical therapist assistant look like? In terms of time commitment, you're looking at 2 years, and it's an associate's in applied science degree that is earned. And when you talk about degrees of economic value, I think PTA is awesome. 2 years, a very respectable salary in terms of your position. That will obviously vary a lot in terms of where you work, part-time, full-time, what setting, but this is an average. We talked about all the settings, lots of opportunities for different types of positions, and then room for advancement. So I've taken my career into education. There's opportunities to be in management of a PT facility, to be the senior therapist or to specialize in different areas if that is what you desire. Okay. The outlook for healthcare in general, I think, is really positive and has only become, more so this year with the COVID-19 pandemic that we're living through. Physical therapy aides do not require any formal education. So anyone can apply to an aide position that is open at a facility that provides physical therapy. All the training that you need is provided on the job, and that's really because you're not going to be doing anything that's not directly prescribed by the PT or the PTA. Physical therapist assistant is what we offer at Malcolm X. Okay, it is an associate's degree and it's licensed. So after you complete the educational part of the program, you will sit for a licensing exam and become licensed in the state of Illinois. And while PTAs do work under the direction and supervision of physical therapists, they have a lot of autonomy. Okay? In fact, in most settings, many settings, the PT does not actually have to be in the same building as the PTA. Okay, they're trained to make clinical decisions and think critically and safely carry out the treatment plan for the patient. Okay, so thanks for clarifying that because I think those are often confused, but it's an important distinction. So we are an accredited program, and really what that means to our students is that you can graduate from our program and become licensed because it's required for applicants to graduate from an accredited program. Okay, so what is your path? You're going to take some prerequisite courses. So there's kind of two parts to the program. There's some prerequisite courses, and then there are PTA specific courses. So we'll talk more about each, but generally in terms of time, the prerequisite courses come first. There are 9 of them. If you take all of them, they're designed to be completed in 2 semesters. That being said, if you want to take them on more of a part-time basis, you certainly can. But the 2 semesters is what they equate to. When you're either completed with those prerequisites or you're just about completed with them, that's the point where you're going to apply to the PTA program. We'll talk about kind of the time frame and logistics of that in a few slides, but you know, it is a selective application process. It's not a rolling admissions. So it is competitive and it's selective. So more about that in a few slides. But if you are then accepted to the PTA program, there are 3 consecutive semesters that are the PTA specific coursework. So a summer, a fall, and a spring semester. And then graduation, you'll take a licensure exam, and that's the point that you can start practicing as a PTA. Talk about on this next slide is that you know, City Colleges really believes in stacking credentials and giving you degrees that, you know, can immediately gain you employment. So one of the cool things about our prerequisite courses is that through completing those courses, you will earn a basic certificate in personal fitness training while you're on your way to that associate's degree. So the courses that are a part of the basic certificate in personal fitness training have this asterisk. So it's psychology, and then 3 of our ESSS courses, 101, 102, and 112. And these are all of our exercise science courses. Okay.
So these are the prerequisites only.
Yes, so these are prerequisite courses. There are 9. So on the left-hand side, you have more of the general education type of courses, and then on the right, the exercise science, kind of a little inching a little bit more field specific, and a lot of which are part of that personal fitness training basic.
And you say we're gonna have a certificate after all these courses, right?
Just the ones with the asterisks are a part of the personal fitness training certificate. So psychology 201, and then ESSS 101, 102, and 112. There are a few requirements. So you have to either have completed all these courses or you need to be enrolled at them at the application point. Also, you need to get a C or better in all of these courses, and the minimum GPA requirement is a 2.5. So with that being said, I always advise students, you know, don't strive for the minimum, strive to get the best, you know, grades in these courses as, you know, as you can. While we look we pull out a GPA when we're evaluating within the program for acceptance. We pull out a GPA for the prerequisite courses. And most of our last 3 classes, the average GPA for these prerequisite classes has been 3.5. So, you know, it is selective, it is competitive, but, you know, I hope you're all up for that challenge. But I want to be transparent with you all. It's selective, so only the top 30
top, okay.
candidates will get into the program each year.
Oh.
Okay. So the technical coursework, if you are accepted into the PTA program, again, is 12 months, 3 semesters. At that point, the classes are full-time and they do run during the day. The summer is completely coursework, and then the fall and the spring semesters are divided between coursework and clinical work, which is the really exciting part of the program where you get to go out and work with therapists in different settings out in the community. So each of those are 8 weeks long, and you will complete 2 of them. Right? And then after those 3 semesters, you graduate, and then it's time to get your license. So now you're seeing those minimum requirements that I was previously speaking to. And again, my advice is just, you know, strive for the absolute best you can, not the minimum requirements. A little bit more info about the PTA program. Again, it's you know, it is full time. It runs during the day. We're currently using a hybrid instruction model due to COVID-19, so that it will be in place for the, you know, an unknown amount of time. But essentially, what that looks like is come into campus a couple of times a week, 2 to 3 times, depending on the semester, and then all lecture coursework is done over Zoom. Okay. We're very team-based. We work in groups a lot. PTA is obviously a hands-on profession, so you will experience a lot of hands-on practice, up and moving a lot during your lab times. We use our virtual hospital that is at Malcolm X as much as we can. And then again, we have 2 clinical rotations that are a really exciting part of the program. Okay, so general timeframe for the admissions process each year. And again, those of you that you first want to make a plan for those prerequisite courses, and then you want to keep this timeline in the back of your head as well. So each year, the application process opens in November. Okay. So if you're looking to apply to the program that will start in the summer of 2022, maybe just make yourself a note in your calendar or some little reminder that kind of November timeframe is what you're looking at next year to get rolling on that application process. We do have open houses in the fall, so definitely keep an eye out for those as well. But you'll apply through your student portal first. Then you'll receive a PTA program like specific application, which will be due at the end of January. In March, we do interviews, and then by April, we select our next class. Cost is always a question that I get. I always direct students to the website that has the tuition and fees chart on it. And that is really just because our tuition is done by credit hour. So if a student took all 9 prerequisites, you know, no transfer credit, didn't test out of anything, the program's roughly $12,000 for the 2 years of coursework, the 5 semesters. But you know, for your personal situation, like if you aren't taking the full, the program is 68 credit hours in total. So, you know, you would adjust that for your personal situation. And then if you live in Chicago or not. Okay. I will put my contact information in the chat as well, but then you'll know that it's also at the end of the presentation.